This is Cleveland Health, the show that tackles health issues that matter most to our neighborhoods. Each week, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Join us as we dive into what's shaping the health of Cleveland today so we can all try to make a difference together. Hi, I'm Richard Stewart. Today we're shining a light on powerful stories and critical health issues impacting the Cleveland community. We visited Cleveland Clinic's Vision First mobile unit, a traveling eye care clinic on wheels, bringing free vision screenings and services directly to Cleveland schools to help keep our children's eyes healthy. And later, we sit down with Care Alliance Center President Ken Griffin for Community Health Center Awareness Month to talk about the resources building a healthier, stronger Cleveland. But first, we visited Neighborhood Family Practice, where I spoke with this trusted community organization about the importance of breastfeeding awareness and their lactation support program. Cassidy and Jordan Moore are first-time parents. Like many families, they quickly learned that breastfeeding doesn't always come naturally.
A roller coaster. Definitely, like every single day is a different story with breastfeeding, but I think Neighborhood Family Practice kind of really helped, join us on that ride and let us know that it is a ride. That's the biggest thing, is learning, what's normal, what's not normal, and really helping us set up for the perfect journey.
Cassidy says the early days were filled with questions about latching, timing, and whether or not her baby was getting enough milk.
It seems like it's supposed to come naturally, but it definitely isn't the most natural, thing as mom and baby. But overcoming them was really just like everything Neighborhood Family Practice kind of set up for us.
Her wife Jordan found her own way to support the effort.
I do anything that I can to keep Cassidy in a good mental state, to keep her fed, to put her water next to her.
Yeah.
Because every single time you sit down to breastfeed, you forget to bring water over and you get this overwhelming nausea that overcomes you. So always bringing water over.
Honestly, just having someone that, also hears and understands what's going on. So she was at all the appointments with me.
Not only is breastfeeding incredibly beneficial for the health of the baby, but mothers who breastfeed for more than 30 months reduce their chances of contracting some ovarian cancers by as much as 91%. At the center of the program is family nurse practitioner Lauren Lasko, Director of Lactation Medicine at Neighborhood Family Practice.
All of our families who are desiring to breastfeed get to have visits with us. I'm a family nurse practitioner. So that means they come in for their first physical, and if their families are breastfeeding, then we help them get off to the best start that they can, with hopefully getting to meet their feeding goals.
Lasko says the benefits go far beyond nutrition. Breastfeeding lowers the risk of breast cancer, uterine cancer, and some ovarian cancers, while babies see lower rates of asthma, diabetes, and even certain childhood cancers.
And it can feel really stressful. It's also a very precious, vulnerable time. And so a lot of parents who are breastfeeding feel like they're not making enough milk, just kind of inherently. So it's a lot of it is like helping them build the confidence that they really already have all the skills they have, and they just have to learn and be gentle with themselves.
For Cassidy and Jordan, the clinic's support has made all the difference, strengthening their confidence as new parents and their bond with their daughter.
The bond with me and her is huge. It's one of those things that I feel like I kind of know exactly what she needs when she needs it.
Also, did you know that while many mothers initiate breastfeeding, rates decrease over time, with about 60% breastfeeding at 3 months and 55% at 6 months? That's according to the U.S. Census Bureau. Breastfeeding rates also vary by race and ethnicity. For more information about Neighborhood Family Practice resources, you can visit www.nfpmedcenter.org. Coming up next, Care Alliance Health Center stopped by the TV20 studio. You'll hear from President Ken Griffin and from patient-turned-advisory council member Tiffany J. Hale, who shares her inspiring journey right after the break.
Today's vote, in my eyes, is not a very difficult one. Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
We're now joined by Dr. Ken Griffin. He is President and CEO of Care Alliance Health Center. Ken, thanks for joining us.
Thanks so much for having me, Richard. I appreciate it.
You're new to this role. How's it going so far?
I am new to this role and new to Cleveland. I've been here in Cleveland for the last 9 months, and it has been phenomenal. Care Alliance is an amazing organization. We've been around since 1985, and being in an organization that was literally started in order to help the homeless population and now helping the underserved population, I get to do what I love to do every single day of my life. So it has been amazing. I have an amazing staff, an amazing board, and the work that we do is so vital for the community.
Talk about what guiding principles kind of inform your leadership and your approach to the position that you now hold.
Wonderful question. Being a leader, being a CEO and president, the one thing that I believe in first and foremost is ensuring that we have collaborative approach to leadership. The top-down approach that so many folks have done in so many different organizations or over life, that really does not work. It's the people that are on the bottom that should be really driving the change in the community. So therefore, I make sure that at all levels, people are informed, and that not only they're informed, but they have the power to give their opinions on what is going on within the community and the organization. A lot of these folks have lived experience. A lot of them have information about what goes on in the community, where I'm new. So with me making decisions towards the organization and within the community, I look to the staff members within the organization in order to make sure that we're being transparent, we're accountable, and we're trusted in the community.
A lot of your patient population may have barriers to access to care. How does Care Alliance navigate those waters and make sure that you're reaching patients where they are?
Wonderful question, Richard. Not only do our patients have barriers to access to care, there's barriers to access to care around the world, around the country, around the city, around the state. What we do is we literally meet patients where we are. We have so many different levels of ways we can assist them. We have 4 mobile units that we utilize in the community. That way they can have treatment inside of the mobile unit instead of coming to our clinic itself. We provide transportation. If you have a barrier to coming to us, we will pick you up. If you have a barrier to getting medications, we will deliver your medications for you. It's a one-stop shop. When you walk into Care Alliance, you can see a primary care physician, you can see a dentist, you can see a behavioral health therapist, you can see a care coordinator to get resources. It's a one-stop shop. That way, when you walk in, you have the experience to get everything done right then and there.
We all know about how patients face social determinants of health and
Yes.
sometimes have bad outcomes. Do you have any innovative strategies to kind of knock that down?
Absolutely. First, being educated on what the social determinants of health are. As we do at Care Alliance, we believe that making sure we tell folks what a social determinant of health is. They don't know. For so long, they've lived their lives saying, I don't have access to education. I don't have access to food. I don't have access to a job. That's a social determinant of health. How can we provide you those resources? What happens is when we do the history and physicals with our patients that come in, we ask those specific questions to see exactly, do you have fresh water? Are you in an abusive relationship? Do you have all of the questions that goes into saying, we can provide you resources if you don't have that, because we essentially want to be your ally in care and make sure we're providing you not only health care, but the resources to be sustainable in life.
You mentioned earlier how essential collaboration within your building is. Have you developed community partnerships to kind of extend your reach?
Absolutely. We would not be around for the last 40 years if it was not for our community partners. We have a partnership with Step Forward in which we're helping them with the 10 Head Start programs that they have, the 40 child care centers and the 4 community development centers that they have. We also have partnerships with Tri-C, CMHA, and so many different other places because we know that we can't do this work alone. It takes a village in order to raise a child, and it takes a village in order to take care of the healthcare community.
Looking ahead, what do you see down the road, say, next 5 years?
Oh, retirement. No, next 5 years, Care Alliance is going to be a pillar in this community as it once was. We want to ensure that we're removing barriers for each and every person to get health care where they are and how they need it. We want to ensure that we're breaking down those walls to provide the care that people need. We want to make sure that it's not only equitable care, but it's care that is innovative, that it's approachable, and we want to make sure we're your ally in care and be the health center of choice in Cleveland.
Well, Dr. Griffin, thank you so much for sharing this information with us.
Thank you,
Good to have you
Richard.
here.
I appreciate you.
We're now joined by Tiffany Hale. She is a member of the Advisory Council of Care Alliance. Tiffany, thanks for being here.
Thank you for having me.
You began your journey at Care Alliance as a patient. What was that like the first time?
Well, I actually came here from a word of mouth from my big sister, because of course she's typically right. And the care that she said she received seemed like a genuine partnership. She said that she was encouraged to ask questions about her personal health. She said that her primary care person asked her questions about herself, and she felt seen and heard. And I dug into so many questions for her, and she said, you know what, call yourself. And I did. The customer service was impeccable. The person that answered the phone asked me if I had any other healthcare needs. And I was like, you offer other things? And he started to mention the behavior health or the mammogram mobile clinic. And I was picked up by that, and I was very appreciative. So I started my journey at that point, and I love my care.
So is that what inspired you to become a part of the advisory board? Talk about that.
Oh, absolutely. So for a couple years, I had the same primary care provider. And because she made me feel comfortable, I would reach out to her and talk about different things. And that led me to meeting one of the phenomenal leaders at Care Alliance. And we started to talk about some other things. And he seen how much I was advocating for myself and other people. And he said, well, do you think that you may want to join us? And I said, of course, absolutely. I was grateful for his leadership.
What type of insights or perspectives do you bring from a lived experience to your service on the advisory council?
Sure. Growing up in that community, I am ecstatic to see that it's nestled in various places that people can get to. It's across the street from a historical landmark in Cleveland. It's a library around the corner. There's absolutely amazing things that's happening there. So I bring the storytelling, the lived experience, and I think that some of my leadership and experience will help guide some of the new programming that we have going on.
Tiffany, from your experience, what differentiates Care Alliance from other healthcare providers locally that you may have experienced in the past?
I would say the service. I felt like there was a genuine, like I said, with my sister partnership, I felt like that my healthcare provider was my ally. I felt like she encouraged me to stay in communication with her. And I feel like that's something that we all could rely on.
Why do you think it's important for patients to have a seat at the table where healthcare decisions are being made and policy is being made?
Yes, and I believe that Care Alliance Healthcare Center does an excellent job with that, pulling in members of the community and being very visible in the community. I feel that having a seat at the table as a patient creates a more authentic relationship because word of mouth is very important. And sometimes if you're too at the top or if you're at the bottom, you miss the middle piece. And sometimes the community members or a patient can fulfill that middle piece and tell them exactly what's happening in their lives. The community and leadership can take that information and disseminate that amongst other areas.
You know, sometimes women don't get the kind of compassionate care in a healthcare setting that they deserve.
Yes.
Can you speak to how Care Alliance performs in that area?
Well, I got a personal phone call for the mammogram mobile clinic from a woman, and she was encouraging me to take care of my overall health. I have not experienced that with Care Alliance, I'm happy to report, but you are correct. In other settings I have where we're not listened to as much or people won't allow us to fully express ourselves. So I think that the programming and the leadership that Care Alliance has enables me to feel a little bit more protected.
What would you say to somebody who may want to seek care from Care Alliance but are a little bit hesitant to go into a non-traditional, if you will, healthcare setting?
I would say unlock your phone screen, dial the number the same as I did, and give it a try. You will not be turned away. You will not be denied care. And for majority of every healthcare need that you have, Care Alliance can fulfill that. And if you ever have a question, the leadership is open and ready to answer questions. No one is hiding behind a desk. They are always in the community to offer assistance and answer questions. So I think if we just take the first step, getting to know Care Alliance, calling, making sure that we make our first appointment, and then we can go off of our own new lived experiences, but you'll never be denied care.
Well, Tiffany, thank you so much for sharing such valuable information with us.
Thank you so much.
Up next, we'll check with the Cleveland Clinic and talk about its Vision First program, the Cleveland schools they visit, and why vision checks are so important for children. Stay with us.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
Welcome back to TV20's Cleveland Health. I'm Richard Stewart. Now, let's visit the Cleveland Clinic's Vision First mobile unit. Optician Rhonda Wilson and pediatric optometrist Dr. Heather Semino take us inside the Vision Bus to share how the program works, the Cleveland schools they visit, and why early eye exams are so important for children. Before the school day starts, The Vision First team is already parked and ready. The mobile vision clinic brings Cleveland Clinic Cole Eye Institute doctors and staff right to school parking lots, making eye exams as easy as a walk down the hall.
The Vision First program is a program that goes to 6 school districts. We do eye exams on pre-K, kindergarten, first grade students.
Inside the van, 2 exam rooms with the same equipment you'd find at any full-service vision clinic.
There's 2 exam rooms, 2 lanes, so we're able to do eye exams at the same time. We check vision, distance and near. We do color vision, we do cover tests, we do stereo for depth perception, and pupils. Everything that we need to do an eye exam. So everything that we have in the Eye Institute, we have in the vision van.
And if a child needs glasses,
parents just have to sign the permission slip, and if they need glasses, they get them from us. They're free, all at no cost.
in just under 24 years, Vision First has performed more than 100,000 eye exams and handed out more than 10,000 pairs of eyeglasses to kids ages 4 to 8, absolutely free. Doctors say regular eye exams are critical, especially because most kids don't even know they're having vision problems.
Little kids don't walk around going, oh, I'm not sure if I'm seeing that well, so they don't realize it until sometimes it's too late.
Untreated vision problems can affect a child's ability to read, learn, and properly develop.
Sometimes it's one eye that's not seeing as well as the other. If we don't catch it in time, it can become permanent.
In fact, the program has even saved at least one life.
We did find a cancerous tumor on a little boy once on the Vision First program, and he is still alive today because of that.
For longtime program manager Rhonda Wilson, who's been with the Vision Clinic for decades, the reward comes in the smiles of the kids.
Little people are easy, adults are hard. I love kids. And it just gives me joy just to help them, move forward.
Now we head to Metro Health as we continue our coverage of Community Health Center Awareness Month. Here at Metro Health Community Health Center, staff say their mission is simple: bring quality health care closer to those who need it the most. From primary care to wellness support, this clinic is helping neighbors stay healthy right here at home. For patients in this old Brooklyn neighborhood, access to care hasn't always been easy. That's why Metro Health opened this community health center to offer everything from checkups to specialty services, all under one roof.
I've worked here for 10 years, and it's always nice to see the generations come through. Like, I've seen little kids growing up, moms coming back being pregnant, 1, 2, 3 different children, and it's just nice to see the different generations come through and the patients kind of like growing and maturing and being able to work with them for more than just one face-to-face session, being able to see them learn and I guess just grow.
Those long-term relationships build something critical in medicine: trust. Staff say patients are more likely to stay on top of their health when they know help is close by and reliable.
Definitely being open with them and trying to teach as much as we can. I always like providing them with other resources. Like if I go through a teaching with a patient, I always try to tell them at the end, you can always follow up with us. If you have questions, please call the nurse helpline, message your doctor, send us a MyChart message, or you can always come back, call for another appointment with me, and I would be more than happy to go through the teaching again, to whatever questions that they need to help them get through it.
Metro Health staff say that type of open-door policy makes a difference, especially for patients managing chronic conditions, and for some, it can even mean the difference between life and death.
I would say as far as my quality of life, it helped. But of course, I'm dealing with things, because we have surgery, you go through things or whatever, so I'm dealing with those things, but I'm here, I'm alive, and I probably would have been dead in 2013 if I didn't come to the hospital and they took the immediate actions that they did and looking, giving me that MRI, giving me everything that I needed, and noticing and seeing those tumors in my body and seeing what was going on with my pancreas and everything. If it wasn't for that, then I probably would be dead right now.
The clinic also provides resources many patients can't find elsewhere, including its own on-site pharmacy designed to remove barriers and keep people on track with their prescriptions.
We translate our labels into 25 different languages. We have home delivery options for patients, making sure that the communities are staying healthy.
With more pharmacies closing in Cleveland neighborhoods, Metro Health says its pharmacy program is filling a growing gap.
As pharmacies are closing down, we're entering these areas known as pharmacy deserts. And really the impact it has is that these patients are the ones feeling the downfall, right? You know, I just have had to reach out to certain providers because there's a pharmacy right around the corner from this location that's closing down. Metro Health isn't going anywhere, so we're still able to offer these services like home delivery and whatnot, just to make sure that these patients are able to get their medications, even if transportation is an issue.
The center represents Metro Health's larger vision, creating healthcare that doesn't wait for patients to come to it, but instead meets them where they live. For Metro Health leadership, the mission is clear: right place, right time, right care.
Like many federally qualified health centers across the country, we are committed to providing services within the footprint of a community, right place, right time. High quality, patient-centered care, where we learn from our patients, where we learn from our community about the needs of that community, and then deliver those services.
From longtime nurses to patient advocates to its one-stop pharmacy, Metro Health's Community Health Center is proving that healthcare can be personal, accessible, and life-changing. Now we'd like to hear from you. Share your story about how your community health center has impacted your life. Send us your answers, and if you're interested in having your health journey covered on TV20's Cleveland Health, you can email us at tv20@clevelandohio.gov. That concludes this edition of Cleveland Health. Thanks for watching. We hope you learned something that could help you or a loved one live a healthier life. I'm your host, Richard Stewart. Thank you for joining us.